Betty is a patient from Cross Lake who has been admitted to the hospital after a kidney health clinic visit due to fluid overload. She has 3+ pitting edema to her thighs and is short of breath on oxygen at 10 liters minute non-rebreathe. This patient is not responding to diuretic therapy. Betty also has had a non-healing foot ulcer for the past 6 months. It is likely that she will require an amputation of this foot if it becomes gangrenous. Betty is at the point where she must decide if she wishes to pursue hemodialysis. Betty has received education in Kidney Health Clinic about all dialysis options. To begin hemodialysis, Betty will need to relocate to the city. Betty speaks very limited English.
Hello, Mrs. Ross. I'm Dr. Komenda. I'm one of the kidney doctors here. Today's talk will help us understand what your wishes are for your care. It is important for us to know so that we can plan the best care for you.
No tiisitin tanssi muisaisin tehtävänä tätä teisi vitseena wats.
Tapi magues kuman muskapi tap miek maski kiin joko kini tuesta mawien. Nyt nyko eske instuuttamaan oma kaitas pinean nyt nimeniten epivitsie kusisi.
I'm thankful that I'm here and the doctors here and for them to try and make me understand what's going on with my disease.
As you know, you've been admitted to hospital because your kidneys are not working very well. Your kidneys are like filters, and those filters are failing. And what's happening is it's causing your body to hang on to extra fluid. And that fluid is making you short of breath. Your kidneys also usually filter out toxins in the body. And when those toxins start to build up, they can make you feel not hungry. They can make you feel very tired. And they can cause your skin to itch. Unfortunately, the medicine we have been giving you for your kidneys is no longer working. In the past, we've talked about dialysis with you and your family and what that would look like for you. We've talked about options for dialysis at home and in the hospital. Today, we want to talk about your care and what is best for you. We want to plan care for you that fits best with what you feel is respectful and proper.
Hispanic uma kaitas pinaniak. Instuten Hispanic niu. Uma kasugawas pinetawiak. Tapos mistay. Ako naman. Tapos animan. Tani wait. Ayuma. Iga wetsimitago. Tansi mausi megigisuitsiek. Akanteen hitamanuma. Dialysis.
I'm starting to understand what's going on with my body. And it's hard. But if I chose not to have dialysis, how can you help me?
Mrs. Ross, I understand this is a very difficult situation for you. This is a lot of information to take in at once. It is quite possible that if you choose not to have dialysis, you will pass on.
Ako no sunman ni yata dialysis tayo. Yusis now ni yata machine.
If you choose not to have dialysis, there are other treatment options that we are able to offer to you.
Ako na machine ni yata dialysis tayo. Tako ni isi which again.
We can continue with the medications that we have been giving you, and we can add other medications that will make you feel comfortable.
Kamitit na ni maskia ka pimit again. Mati kiwich hu patani ti.
Chances are your kidneys will not start working again, and you will pass on sooner rather than later without dialysis.
Isna on made yet tom that to skip it ti. Ako no sweepers kapunt match in the nice.
We will do everything we can to keep you comfortable until you pass.
Natuti nan ma te switch it yet the most hitain is kapunt match.
Mutta niin kuin stuuteen on maga omaskin kivinen kaiset minäkin näkin stuutaat. Maga niin oman matsin. Ako magaisi pettamaan kaisi viittamaujek maski kivinen joko kiina kai tuostamaujen. Omiseten stuuten tanssi keispanik ma puniutnamaan juoja maski kamini kaujan. Ako niissä enemmän. Kaikenkin konseptakin pitne kaatek. Ei usein me siitä niittämään. Tanssimaan kekittiisi vitsi kaujan ei usein enemmän. Tuuttamaan aga utnamaan enemmän skiikia.
Now I understand what's going on with my disease. This is my life. What would happen if I chose not to go on dialysis? How are you going to help me?
We'll give you medicine to take away your pain, your worries, and your shortness of breath.
Kamitit nan maskia. Jätä musti hyvin. Jätä miuskatti hittämän. Omnia koiste ei päitä tämän.
We'll also give you lots of support as you deal with worry about what's going to happen.
Kasituskat nan minä. Jämsti tämän hittämän juoi. Apuja vata ustaman.
Towards the end, you may become unconscious, but even then, we'll still give you medication and support to keep you comfortable.
At iskoajats, mä joan gatiskitin. Mutta tämä kamitit nan maskia. Jätä musti hyvin.
Would you like more time to think about your care?
Teitinä no meistä mä mitun hittämän. Muutse.
Stuuteen oma kaisi viittamaujek. Omaskin kivinen kaitet. Ogista kaisi jäin. Kaisi piikiskottaman. Oma kaitaas pineään.
I understand now what you're telling me, what the doctor's saying from your interpretation about my disease.
Miset ni on jaakan tuu teemak. Umoutse dialysis.
I've lost a lot of relatives that were on dialysis.
We will make the plan for your care just as you have said.
Tämä on se ei suitsein. Ja mä kai kiittyinisi.
We will do everything we can to keep you pain and worry-free.
Now ei tutinän. Sieltä ei muussa hyvin omini ja on tämä jos katsi hyvin.
Do you have anyone to come and be with you at this time?
Ei tänä on että piisitos käs.
Te peneen tuu teemään peitap minua.
Yes, my family will come be with me.
We will respect your wishes about the discussion that we had here today. Right after we leave here, I will fill out an advanced care planning form to communicate to your entire care team about the discussion that we had here. You can change your mind at any time. I would encourage you to talk to your family and friends about our discussion here and your decisions about not going on to dialysis.
Betty will be provided with a copy of the completed Advanced Care Planning Goals of Care form. This will be reviewed by the patient and the interpreter resource worker. Betty will be encouraged to communicate her decisions regarding dialysis to her family and friends.